Our study is racial disparities in treatment for children with autism spectrum disorder. Background: historically, racial and ethnic minority children have suffered from delayed diagnosis of ASD compared to white children. Recent studies have suggested that gaps in age of ASD at time of diagnosis among racial groups have decreased. However, studies about racial and ethnic disparities in treatment of ASD are lacking. It is unclear whether racial and ethnic disparities still exist in minority children receiving ASD treatment after diagnosis. Racial disparities in treatment for minority children with ASD may negatively affect their cognitive, social, and behavioral development. Our objective was to determine if racial and ethnic minority children are less likely to receive treatment for ASD compared to white children. Our methods used a data analysis of a cross-sectional survey of the 2021-2022 National Survey of Children's Health, which is a nationally representative survey of children. Our study population was children under the age of 5 years with the current diagnosis of ASD. Our outcome was ASD behavioral treatment using a questionnaire. Race ethnic demographic. The race and ethnicity of the children was NH Asian, Black, White, multi-race, and Hispanic. Statistical analyses that were used was mean and standard deviation for continuous variables, frequency and percentages for categorical variables, chi-square tests, and univariate and multivariate logistic regression models. We included a total of 790 children, with their mean age being 3.8 and their mean age of ASD diagnosis being 2.5. This age was similar among all racial and ethnic groups. Behavior treatment received was highest in NH white with 72.4%. It was lowest in NH black with 56.4%. When we adjusted for covariates of age, sex, severity of ASD, parent education, and Medicaid coverage, NH black was still lowest compared to NH white. All other racial groups were not statistically significant. Factors associated with ASD behavior treatment was ASD severity and parent education. Discussion. Our study findings are in line with recent studies that suggest that Hispanic and NH Black children experience the most significant disparities. Age at ASD diagnosis among racial and ethnic groups were similar. However, minority children with ASD experienced more delayed treatment compared to NH white children. Conclusion. Among a nationally representative population of U.S. children, we found that behavior treatment disparities in ASD for children under the age of 5 years still remained for NH Black children compared to NH white children even after diagnosis at similar ages. Given that behavior therapy should ideally be implemented shortly after ASD diagnosis, targeted interventions for racial ethnic minority groups are needed to address the gaps in therapy to promote equitable and optimal development, especially for NH Black children with ASD.